So the benefits of wearing a mask are that you're preventing transmission of water droplets. When we speak or when we cough, these water droplets will come out and they'll actually be transported by the air several feet.
My recommendation is get a mask that you're going to wear because any mask is better than no mask at this point.
What we're trying to do with the face mask itself is the wearer is trying to prevent transmission of those water droplets that could potentially contaminate or infect another person.
The big thing with masks is it has to cover you from the bridge of your nose all the way down to your chin.
It's sort of like wearing your seatbelt on one shoulder and not across your lap and your body the way it's designed. It's not going to protect you in a crash if you're improperly wearing your seatbelt. The same idea with a mask. If you're improperly wearing it, you're going to increase your risk of transmission because it's not protecting you.
It is important that as we as a society work together so that we can get back to our jobs, schools. So wearing of the mask is going to be essential in order for us to get there.
Our hospitalization has also shown that there's been a shift. It was older patients. Now it's coming more into the 20 to 30-year-olds are becoming hospitalized.
We're seeing that in our hospital as well as our ICUs.
I call them the young invincibles because they're young and healthy. They feel that they may not contract the disease, but they could be spreading it unknowingly.
One person may end up fine, 5 days, no harm. Another person may end up in a hospital for 14 days with significant issues. A third person may end up having a very poor outcome.
We really don't know enough about how it is fully spread and what the full long-term effects of the disease is. So even if you may get a mild case, you don't know what the long-term consequences of the disease is. So it's better to be safe.
The idea that we were going to develop some sort of herd immunity was very good, but we have seen that it requires much more people getting infected, and we're just not there.
Herd immunity is something that we probably won't see for another 1.5 to 2 years. Okay, and viruses tend to mutate quite frequently.
The vaccine is several months off, and we're not going to get to the vaccination until potentially the end of the year.
So it's going to take a while. In the meantime, the best thing that we can do is to do great things, is to wear your mask, okay, particularly when you're in front of other individuals, because that protects them and their mask protects you, as well as washing your hands on a regular basis. That's the best protection that we can have today.
We need to look at our subject matter experts. Start to believe in the science behind this, as opposed to some of this myth that's going around about the dangers of masking.
I think that at the end of the day, personal responsibility is going to be what brings our curve down and help save lives in the state of Florida and in our country.
This is a public health issue, and much like the way we mandated seatbelt use in cars to prevent deaths, it's exactly the same idea here.
At the end of the day, you may not think that it's going to affect you, but the sooner we get everybody compliant, the sooner we can get back to a normal life.